for the very people who have the potential to drive economic growth in Africa. The resolution on strengthening diagnostics capacity requires us to partner to develop national strategies and sustainable funding mechanisms that ensure a strong diagnostics backbone for Africa and one that collaborates with the people it serves. We all share a collective duty to drive this mandate as both the public and private sector. At Roche, we have an ambitious strategy to increase access to diagnostics in Africa tenfold over the next 10 years. And we look forward to working with all of you to realize this. Thank you very much.
Thank you very much to Dr. Pamba and the team. It's been 4 days of deliberations and debates and dialogues, so right now we're going straight into the synopses of the daily scientific tracts. I'm going to ask that one of the lead rapporteurs, Dr. Kanye Msomi, please come and join me on stage for a summary of day one titled The Challenges and the Opportunities Facing Laboratory Medicine in the 21st Century. Let's welcome her.
Good afternoon, ladies and gentlemen. So mine is just to summarize the events of the first day of our conference, which was themed A Changing Landscape for Lab Medicine. We looked at the challenges and opportunities that face the discipline of laboratory medicine. So just at a glance, in this theme, we had various topics and themes that were covered. We had a lovely keynote speech, which set the note for the conference. That was followed by a plenary, which had three key areas of discussion looking at planetary medicine, innovative technologies, and new health threats that face our disciplines of lab medicine. We then had a special session which was looking at the future of genomics in Africa. The symposia that we had looked at mobile labs and how they can be applied in solving the challenges in Africa. And we looked at antimicrobial resistance as well as diagnostics and how we can get the diagnostics to our communities that need them. We looked at capacitation of our workforce so as to advance the development in lab medicine. We had some interesting debates on the first day looking at self-sufficiency in the African continent in driving lab medicine. We also looked at how we can embrace artificial intelligence and how we can incorporate the One Health approach in lab medicine and diagnostic value chain. We had various oral abstracts as well as posters, and we had a variety of topics, including antimicrobial resistance for the day, also looking at diagnostic outbreaks as well as surveillance, and looking at how lab systems can be improved and how diagnostic and network optimization can help in the advancement of lab medicine. Our satellite sessions looked at transforming TB diagnostic into the new age, the 21st century. We navigated how we can find our way in the regulatory path in both research and development of diagnostic assays, as well as how we can innovate in primary healthcare diagnostics. So starting with our plenary session, we had three very important topics that were covered. Our first very lovely talk, which was given by Dr. Renzo Guinto, looked at planetary health, and the highlights that came out of that talk was how climate change and how climate is amplifying infectious diseases and how this could set a path for the emergence of the next pandemic. And the threat of zoonotic spillover of infections, with some projections that we could see in excess of 15,000 instances of virus leaping between species, and obviously posing a threat for human outbreaks over the next 50 years. This is obviously worrisome in the context that medical practitioners and people in lab medicine as well are not yet operating as if this is a real threat in our current instance. We looked at the next talk, which looked at emerging health threats. and how we can find new interventions to deal with this health threat, which was given by a representative from the WHO. Here, a discussion on how improving lab systems and improving the capacity within lab systems can help in this regard. How pathogen and genomic and epidemic intelligence using open sources can be incorporated and help to contribute to this new vision of collaborative surveillance as a way of mitigating these emerging health threats. And lastly, we had a plenary discussion on innovative and disruptive technology for diagnostics. And here we had learnings and innovations that we gathered from the recent COVID-19 pandemic that we've just emerged from, and how these are being applied in diagnostics, and how these can also be used to catapult laboratory testing for global priority diseases. On that day, the first day as well, we had a special session, this being a conference that is looking at 21st century solutions, and we looked at the future of genomics, which obviously features very strongly. We had perspectives from African scientists as well as from industry. From African scientists, what came out as highlights in the future of genomics is how genomics need to help in serving our public health needs, and how they need to be integrated into existing systems in our public health systems and research institutions and ministries of health. And this synergism will obviously help in avoiding the fragmentation that currently exists and move forward the future of genomics. We also need to breach the underrepresentation of African genomes, which was a common thread that came out from the speakers in global bioinformatic databases. Our industry partners, manufacturers, also highlighted that the future of genomics in Africa is an important one, and that Africa stands right at the forefront. We also need to work together to address the challenges, and obviously industrial genomics and bioinformatics support would be critical in pursuing this and pursuing the area of R&D in Africa. So what were the key lessons learned from the first day? Our plenary keynote speaker from the first day, Ambassador John Kengasong, gave a talk where he highlighted that we have a very serious threat of an increasing population, especially in Africa, where the projection is that 2.5 billion people will be in Africa over the next 30 years, and that 1 in 4 people in the world will be from Africa, and we need to prepare accordingly for this eventuality. We also had a speaker who spoke about how the value of each diagnosis that we do and each diagnostic test that comes out of our labs needs to be balanced with the pre-test probability of disease in the community in which this test is being conducted. And that this must also be balanced with the cost and the clinical utility of the test that we offer. And that was from Professor Lee Schroeder. And lastly, Dr. Robinson also spoke about how COVID-19 highlighted the gaps that exist in the lab, and that we need to capacitate our workforce and build this capacity through commitment and collaborative efforts, so as to develop career tracks of our laboratorians to be able to serve us in good stead in the 21st century. So how do we move from here? We had a highlight from Mr. Nobile Ndlovu, who highlighted that going forward with all the challenges that have been put up in the African lab space, that public-private partnership will play a very critical role. This, combined with political will help. We also need to increase our representation of African pathogens to prevent control of diseases in Africa. This will ensure that proper vaccine surveillance happens, as well as proper monitoring of trends and mutations that can lead to the emergence of infectious diseases that may yield pandemics. This came from Dr. Tabile Lukeni. And lastly, we had a very energetic presentation on artificial intelligence given by Professor Jude Kong, who told us that AI is not really in the future, it is now. And we need to embrace it, but obviously we need to prepare accordingly and hasten to create proper regulatory pathways to make sure that there are proper ethical frameworks, as well as a buy-in in the reliability and acceptability of AI in the lab space. These are the last take-away messages from the first day, is that even though we highlighted the challenges that exist in the lab space, there are also opportunities available. We can pivot from the experiences of COVID-19 and the lessons that we learned as Africa. We can also innovate and address the unmet gaps in the laboratory, in the African lab space. Our innovations that can be put in is obviously things like incorporating fully comprehensive mobile labs in our far-flung areas, implementing collaborative surveillance systems, as well as strengthening the genomic surveillance that we have already put in place in Africa. And this can build to support our R&D, not just for diagnostics, but also for vaccines and therapeutics. We need to optimize our diagnostic network so that we can serve and provide proper coverage in the communities that we serve. We know of the new resolution that came from the World Health Assembly that puts the importance of laboratory medicine in the forefront of the world, and we need to seize this opportunity and pivot from that. And the future of a diagnostic initiative, which was introduced to us, will play a very crucial role in helping Africa attain self-sufficiency going forward. Thank you very much. That is all for me.
Thank you, Dr. Nsoni. Now join me in welcoming Dr. Marie Margriet Masinga Noembe. She'll be doing the
symposium, one on collaborative disease surveillance, one on non-communicable diseases, innovation and waste management, and finally one on optimizing laboratory network and diagnostic services. We also had 4 roundtables in the afternoon about knowing more and acting smarter. What is the power of the community of practice and the knowledge of communities? We had also 1 roundtable discussing around unlocking the private sector, the partnership in order to attain sustainable and equitable access to diagnostics. And finally, there was a roundtable discussion about the career prospects and the retention for scientists in Africa. There were 4 abstract sessions covering innovation, 1 on workforce, 1 on quality, and 1 on next generation sequencing. And those topics were also mirrored during the poster session. And I must say that day 2 was the day of the satellite session with 10 of them, really touching to many topics. But maybe the one which stood out the most was the ASLM Lab Directors Forum launch, or the Lab DF, which was formally launched on the evening of that day. About the highlights from the plenary session. So there was first a topic touching to laboratory governance and leadership, and how laboratory governance needs to be elevated such that the lab directorates can be provided with the means, so their rightful authority, but also the financial resources that they need to carry out their mandate. And this was the message from Dr. Yenu Kebede. We also had a nice presentation from Professor Iruka Okeke, really showcasing how actualizing the roadmap for genomic surveillance of AMR required clinical bacteriology and bacterial genomics to go in tandem, or how to harness really the capacity in the research and academia sector to really achieve public health impact and optimize public health impact. And the plenary session was closed with also a keynote presentation from Dr. Susan Kiwanuka, which really showcased to us how we needed to transition from a traditionally reactive strategy to a more proactive strategy to make sure that laboratory workforce can be developed and can be maintained up to speed and up to date to tackle all the new areas emerging for the laboratory workforce, such as task shifting and also planetary health. Regarding the special session about transforming diagnostics and the role of AI, robotic and technology and computer science, we had a strong cry from Professor Maduka Pai, really, that considering the contribution of AI, microscopy should now be eradicated from the diagnostics of tuberculosis. It was also demonstrated that appropriately implementing AI for community-based diagnostic services could significantly enhance healthcare accessibility in hard-to-reach and remote area for efficiencies and accuracies. And this message was conveyed by Dr. Tiwani Mashamba Thompson. And finally, we know that AI holds formidable promises to revolutionize the diagnostic landscape. However, for it to make an impact in Africa, it is necessary that machine learning properly accounts for African data and include African data, so the anticipated benefits can be relevant to our local context. And this was the message from Professor Jukon. About the lesson learned, so from Professor Iruka, really, we were inspired that, based on what has been learned and seen from the COVID-19 response in Uganda, expanding diagnostic access is possible. Anything is possible if the pushes aren't enough. And then from Dr. Manis Pierre, innovation, such as incorporating telementoring into healthcare professional capacity building, will allow professionals to apply critical thinking to the complex situation we are now faced with. And then finally, a strong message also from Dr. François-Xavier Babin, about what is the next step for diagnostic network optimization, and that we should ensure that DNO approaches, which are not only surveillance-oriented or equipment-oriented, but should rather be transversal and should be addressing several etiologies. How do we move it from there? So we had a strong message from someone who was in the room. She was heard loudly, but finding a picture was just not possible. Apparently she's not present on the internet, but that is Dr. Christina Mwanji from CDC Uganda. So our strong message was that we need to translate into policymaker language the cost of not investing into lab services at primary healthcare level, and what that represents in terms of life lost. And we should be able to elevate the discourse beyond ourselves, the lab community, and even beyond the Ministry of Health, and reach out to other critical stakeholders, such as the Ministry of Finances, to ensure that the necessary funding is allocated to diagnostics and lab network. And Dr. Yinuke Bede really emphasized the need for continental coordination of laboratory system strengthening effort with help to harmonize multiple initiatives and facilitate sharing of experience, best practices and data across member states. And Clément Douaré also made a nice statement about what AI solutions hold for Africa. They can be very powerful, for example, to identify bacterial strains, but really the need to be contextualized for African settings for optimal impact. So what are the key takeaways? Laboratory directorates need to be reinforced. Laboratory director will not be able to move the agenda without a clear mandate and associated budget. And we do hope that ASLM Lab Directors Forum will be really instrumental in achieving this goal. Artificial intelligence should be embraced. However, we should ensure that the necessary discussions to address how it can contribute to enhance laboratory diagnostic and healthcare in Africa are taking place. And finally, addressing the crisis of laboratory workforce requires an ambitious and whole of government and holistic approach, which can tackle the number, the skills, and welfare of laboratory professionals. And that is it for me. I thank you for your attention.
Thank you, Dr. Nwembe. Our third day presentation and the summary will be done by Dr. Mrs. Ndembe on the theme of the way forward to transforming laboratory medicine for the 21st century. Please welcome him.
So, I'm going to be brief. I've been one to stick to my 5 minutes. So, I think we've all talked about how we definitely would like to transform laboratory in the 21st century, but I'm going to connect the two, the one and the two, on one key element, really, which is around local or deep local manufacturing. Next slide, please. So, I think this is a very good example, really plenary, on how we can definitely really put the context of, in the context of a pandemic, strengthened research and development, really robust research and development in the case of a pandemic for diagnostics manufacturing. I think Morocco showed a very clear example, and Dr. Hassan really illustrated the leadership shown by Morocco, the Institute of Dakar, and South Africa in manufacturing COVID-19 tests. But unfortunately, most of those diseases that Dr. Yenu mentioned during his plenary, we do not have or we don't manufacture locally some of those rapid diagnostic tests. So we need to establish basically the message, a framework for vaccine development, which is already in place, for diagnostics and therapeutics for this continent. We are 1.4 billion people. I think if we cannot manufacture basic commodities like rapid diagnostics, we are not ready to respond to any pandemic. So I think it's a thought-provoking presentation. I was very impressed how we can move out of really the lab, bring the context of equity philosophically, I can say. But the bottom line here was really decolonizing global health. But North, South, and then also gender, because we need to be very careful in terms of how we can decolonize and really bridge the gap around equity. So the message here very clearly is that we need new models of North-South collaborations. We need to think differently out of the box to bridge that inequity in the global North and global South. But again, all lies on us, on partnerships, equitable partnerships that we're engaging to be able to drive that. So the last presentation during the plenary from Dr. Alemji was also very clear, the programmatic really pillars from PEPFAR, which is one of those great partnerships of this century. I've shown that again, a disease threat in one of the countries is a national security and development threat globally, which we have seen during COVID. The World Bank and then all those development banks have shown how we've been really affected by COVID-19. But again, a clear emphasis on deep local manufacturing, both for diagnostics, therapeutics, and all those pandemic threats that we have to deal with. But PEPFAR is putting a lot of money, close to $20 million, to be sure that they encourage locally production of some of the rapid diagnostic tests on the continent. So we move a little bit there on the oral presentation. Again, excellent oral presentation. I think kudos to Dr. Pascal and Professor Iruka, very good presentations and oral presentations as well here. But again, for each of those ones, they are very key elements that we need to take into. So building partnerships, building equitable partnerships. How do we really network across the continent to address issues around AMR, diagnostic network development, health supply chain management, lab equipment calibration, which we have to deal with as part of pandemic preparedness, prevention, and response. Then tech really integration. We have been talking about this, the Maputo Declaration, 10 years back, but we again have to deal with it. We need to integrate. It's very important. So achieving integrated testing requires planning, collaboration, and learning from or adding into the existing performing system. Again, this is really sustainable, and again, we're going to gain in terms of cost effectiveness here for this beautiful continent. So when we move a little bit again down the line, biosafety and biosecurity, extremely important. The key message there, establishment of strengthening biosafety and biosecurity association to promote training, capacity building, advocacy, networking, and promotion of best practices is very important for this continent. I love this statement on data. Data is Data is gold for public health. Gold is expensive because it's valuable. So this translated speech volume here. So, but again, for data, we need that interoperability. We don't want 55 countries with different systems. It makes it extremely complicated to be able to build a lab or strong or robust lab system. So we need to build lab networks in the backbone as part of our National Public Health Institute as part of pandemic preparedness, preventions, and response as well. So let's move to the community. We didn't talk about the community. They are the center of what we're doing. Because ultimately, those rapid tests are going to land in the community. So we really have to talk with the community. We have to engage in the community at the clinical trust onset so that we ensure that we actually speaking the same language when the products are available. So it means that one, we need to adapt an essential diagnostic list to national EDL, a key priority for access, very important. Key enablers for community testing, including point of care, self-testing, digital health, building community health force, artificial intelligence and machine learning, and then lastly, crowdsourcing strategies. We should rely on what really the community takes to be able to bring it at really a development stage. So, what I think we should take away here is really we need a new public health order. So it means we need to strengthen our National Public Health Institute. That's extremely important as part of our response to any global threat. We need to strengthen local manufacturing. I'm going to give just two figures here. Only 1% of all vaccines that have been administered on the continent are produced in Africa. It's unacceptable for health security. Less than 5% of rapid diagnostics are produced on the continent. Again, we need to work very hard. Kudos to Morocco, South Africa, and Senegal, but we need more. So we need really respected-oriented partners, global funds, PEPFAR, and others, FINE, BMJ, to be sure we drive this agenda collectively. Again, emphasis on really transitioning from silo to integrated diagnostic services and systems. And I will end here. If you forget anything from this day 3, we need the 5 Ps. We need partnerships, policy, politics, population, and the pathogen. The population is our community to be able to address any human or community-related threat. Thank you so much. And
Thank you, Dr. Ndembe. So those are the 3 reports over the 3 days. I think these presentations certainly have shown that over the last 3 days we've seen calls to action, calls for partnerships, public and private, a lot of case studies that really can show us where as a continent we can grow, and the systems needed to strengthen the mechanisms that we already have on the African continent. We're now going to move on. Over the last few years, the ASLM community has mourned the passing of some prominent figures who have made significant and substantial contributions to the field of laboratory medicine and healthcare in Africa. We'd really like you to join us in taking this moment to pay tribute to the outstanding professionals whose enduring legacies are recognized, commemorated, and valued. individuals who have played such a major role in science. And I'm truly honored to join you in paying homage to them this afternoon. The ASLM vision embraces a healthier Africa by ensuring access to high-quality laboratory services for all. In pursuit of this goal, the ASLM seeks to recognize exemplary contributions in this field. And so this year, we give recognition in 3 different categories. The first recognition is for laboratories attaining ISO 15189 and ISO 17025 accreditations. Now, this is not just recognition, but it's also a testament to the relentless pursuit of quality and competent laboratory practices, setting a benchmark for excellence and inspiring a future of quality and innovation. The second recognition is for the ASLM Academy Recognition for Excellence in Presentation. And this category celebrates those who have mastered the art of communication, turning complex scientific concepts into engaging and understandable presentations. We are proud of our exceptional communicators and their ability to convey very complex ideas with clarity and enthusiasm, which not only educates, but it also inspires. And then our final award this afternoon is one of great prestige. It is the Lifetime Achievement Recognition in African Laboratory Medicine. And this award honors an individual whose contributions have significantly influenced the landscape of laboratory medicine in Africa. And so we're immensely grateful for this individual's pioneering spirit and enduring impact. And so let's move straight into the first recognition, accreditation. This, of course, as I mentioned, is for African laboratories in attaining ISO 15189 and ISO 17025 accreditations. We celebrate their commitment to excellence, but we also celebrate the fact that they brought us a message of inspiration for laboratories worldwide. And so these accreditations represent a relentless pursuit of excellence, ensuring technical competence and a commitment to consistent, reliable and accurate testing that is crucial for patient care, but also for public health. And so from Cape Town to Cairo, from Dakar to Dar es Salaam, we're now embracing ISO 15189 and ISO 17025, which is a symbol of the commitment to medical sciences. This particular initiative is not just about meeting standards. This emphasizes accuracy, reliability, and timely results. These laboratories are enhancing healthcare, advancing scientific exploration, and impacting millions of lives on the continent. They are leading the way in setting new benchmarks in the world. As it is said, in our differences, there too lies our collective strength. And so we acknowledge a variety of laboratories, from animal health to research, blood banks, and EQA providers who have been embracing quality and high quality standards and excellence. It is our collective efforts to enhance healthcare qualities and contributions to societal well-being and care that has brought us here right now. So congratulations on your achievements, your significant achievements, your journey of improvement and excellence in an inspirational manner. You have been a beacon of hope and of progress. I will now ask that Teferi Mokenen please come and join us in handing over these wonderful accolades. He's from QMS, SLIPTA, Program Manager for ASLM, and he will present the ISO accreditations this afternoon. That was a mouthful. I hope you have less to say than maybe so.
Okay. Yeah, okay. Good afternoon. Let me begin with our historical data that we have at ASLM. In 2009, the number of accredited medical laboratories in Africa was 340. Then in 2013, we had 390. And then in 2014, we had 422 medical laboratories that achieved ISO accreditation in Africa. But after almost 10 years, the record in this year, in 2023, becomes very, very surprising. And today I'm very, very delighted and proud to be here, standing in front of you to share this amazing information. Africa, for the first time in its history, has passed the 1,000 landmark and have got more than 1,000 medical laboratories accredited in our history. So we do have now 1,326 medical laboratories that have achieved ISO accreditation based on ISO 15189 in 29 African countries. And we do have also 270 research and blood bank laboratories that have gone through ISO IEC 17025 accreditation in 8 countries. We do have also 37 animal health laboratories that achieved ISO accreditation with 17025 in 9 countries. And we do have also medical-related PT providers. There are 7 in number that have achieved ISO accreditation using ISO IEC 17043 in 5 countries. And this is a remarkable achievement when it comes to accreditation. And it demonstrates a strong commitment to quality and competence in laboratory practice across the One Health sector and again in various disciplines, as you can see here. And again, we need to recognize the best and excellent performance of some of our accrediting bodies in Africa. We do have now more than 10 which are falling under the AFAC system. But again, we also appreciate the support that we receive from those accrediting bodies which are coming from out of Africa. In any ways, the first one would be the SANAS, and the second one would be SADCAS, and the third one would be KENIAS. These are the 3 excellent performing accrediting bodies in Africa, which have accredited more than 100 laboratories in various countries. And we need to applaud and recognize their achievement in terms of accreditation. And we are still looking forward to the other accrediting body to follow their strategy and step to catch up and contribute in the number of accredited laboratories in Africa. And this picture demonstrates amazing information. In terms of the regional coverage, we do have higher coverage in Southern Africa because of the tremendous contribution in South Africa, and followed by East Africa. This is mainly because of the contribution from Kenya, Uganda, Tanzania, and Ethiopia. And it will be followed by the North African because of the contribution from Egypt. So these countries need to be applauded for their outstanding achievement in terms of application. So today we need to celebrate their outstanding performance in terms of accreditation because they helped us to write a new story in Africa. And appreciation also extends to other countries which are pursuing this standard for excellence, and their effort and our collaboration would be very crucial in enhancing the global scientific community in terms of achieving and providing quality diagnostic service to our users and population. And to our colleagues in Central Africa, of course, recently at ASLM, we are supporting Congo, Brazzaville, and DRC to enroll few laboratories into the accreditation program. But we are ever more committed to support the step that we are going to take to achieve ISO accreditation. So we will be with you and would help the Central Africa to bring the number of laboratories accredited there. So far it is covered, which is contributing 0.6 in Central Africa, and it is really very encouraging. These achievements are more than just certificate. They represent commitment to reliable and accurate laboratory service, essential for effective healthcare and research. Our effective goal is to establish a future where high standard laboratory practice are the norm and the standard. This is a journey that we are all in together. Congratulations once again to those countries and accrediting body for their excellent achievement and performance in achieving ISO accreditation, where they now would belong to the world class, and this is really amazing and encouraging. And with this, I would like to thank all the contributing implementing partners, institutions, and countries. Thank you very much, and congratulations.
Thank you very much, sir. We're now moving on to our second recognition award. You know, as the ASLM, I'm very proud to highlight the prestigious work that is being done in the realm of presentations. And so the second award is for a recognition for excellence in presentations. And this recognition underscores the importance of innovative research and dissemination of knowledge in advancing laboratory medicine and African healthcare. The recipient of this award has set a benchmark in quality and the impact they've made through their presentations, inspiring peers and shaping future research. Celebrating these achievements not only honors the recipient, but also motivates the entire community to strive for excellence in their scholarly contributions. So, ladies and gentlemen, I ask that you join me in putting your hands together for the 2023 winner of the Recognition for Excellence in Presentations Award. It goes to Judith Mzeche.
To my heart, she says I'm used to love. I'm your dream king. I'm your lucky packet. I'm your foreign planet. I'll make the night sky dance for the sun. Oh, she's begun. She'll live forever.
Ladies and gentlemen, Judith Mzeche, she presented Diagnostic Integrations, a case for Zambia. She's worked with the Ministry of Health there for 13 years, where she spearheads the TB diagnostics program. Just another round of applause for Judith.
Thank you very much. ASLM, thank you for this. My word to everybody here is based on my presentation that integration is possible and it is doable. Let's not resist it. Thank you.
We will now honor remarkable contributions to African laboratory medicine. the Lifetime Achievement Recognition. Today, we put the spotlight on a trailblazer in medical research for the African continent and beyond, celebrating his pivotal role in the work that he did, quite authoritative work that he did in Ebola. He has guided, I cannot do this ad lib, I must read it because he has done so many things. He has guided global health initiatives on many frontiers. Professor Amadou Alpha Sall. That's right. He spearheaded the Diatropics platform at the Pasteur Institute, a groundbreaking initiative for producing affordable rapid diagnostic tests in Africa, targeting key diseases like yellow fever, Ebola, and COVID-19. And this project, in collaboration with Mologix, aimed to revolutionize healthcare accessibility and disease management across Africa. Esteemed in the World Health Organization expert groups and with over 100 scholarly works, his insights into arboviruses and fever has been groundbreaking. And now, I might get this wrong, forgive me, I mean well. He's been recognized with a Grand Prix de Président de la République pour les sciences for his and gained legacy, and it has been profound. I see everyone who speaks French looking at me like I need to go back to school. I will. Professor Sall's vision and leadership exemplifies a significant stride in strengthening health systems and enhancing epidemic preparedness in Africa. His dedication to the technological innovations and healthcare on the continent is recognized and sets a new standard for global health innovations. In honor of his unparalleled dedication, his service to laboratory medicine and healthcare in Africa, we are proud to present the Lifetime Achievement Award to Professor Amadou Sall. While he couldn't be with us here today, we would like to ask that Dr. Amor Faye please join us on stage to accept this award in absentia.
Good morning, ladies and gentlemen. So let's say some word on behalf of Dr. Amadou Sall, who cannot attend this meeting. I have to thank ASLM for this award. Thank you again for this award.
Ladies and gentlemen, our winners today not only represent a pinnacle of achievement of their respective fields, but also they embody a bright future of laboratory medicine in Africa. So thank you for their contributions, and thank you for giving us the opportunity to recognize them. I'm now going to ask that the co-chairs of the ASLM 2023 conference please come and join me on stage. Join me, please, in welcoming Professor Marufi and Dr. Chetty. Professor Marufi, I will ask that you address the room first. Thank you.
Thank you very much. Dear Mr. the President of the Board of the ASLM, my friend Patrick, dear CEO of ASLM, my friend Nkoblu, dear estimated colleagues, experts and scientists that participate warmly in this very important conference, honored guests, my dear fellow also co-chair, professor, and also their chair of scientific committee, honorable assistants, ladies and gentlemen. As we conclude this transformative and important ASLM conference in Cape Town, I would like to highlight, if you permit my colleagues and friends, the wheels of thoughts, idea, and lessons, important lessons learned and shared during this event, this important event. We have navigated a terrain rich in innovation, shaping the future of laboratory systems and diagnostics in the 21st century with rigor and vision. In our final moment together, I wish, if you permit, dear colleagues, to emphasize the three core topics and themes that for me seems that emerged as pillar in our continent for the development of lab science in our continent. The first pillar is the pursuits, the vision of pursuits of self-sufficiency and sovereignty, continental sovereignty in laboratory sciences. The second topic and pillar is the imperative of developing holistic science, research, and development for diagnostics and other health products that are very important for our health security in continent. The third pillar is regarding the strategic importance, and we debate a lot during this conference, this topic, regarding improving regional manufacturing, including the crucial integration, if you permit, the North Africa region into this our collaborative framework. Self-sufficiency or sovereignty, continental sovereignty, represents a paradigm. It's a shift, mental shifts towards independence and empowerment within the African continent. It calls us for a transition from external dependence to cultivating our regional capacities, our trust. It is very important to trust on our capacities, and our capacities we can do a lot of things. I think this is a spiritual and mental shift that should be really are the determinant of this self-sufficiency vision to implement. Our focus must be on leveraging first the political commitment for this vision. Second, local talent development. And the third, resources mobilization and expertise to create resilient systems tailored to our specific challenges and needs. The second point, the role of research development in laboratory sciences cannot be overstated. It forms the backbone of this sovereignty. We cannot talk sovereignty without this capacity of developing ideas, molecules, and drugs ready to manufacture locally in our continent. The pandemic has catalyzed unprecedented